What is drug resistance in pharmacy? A. When a drug loses its effectiveness against a certain pathogen. B. When a drug becomes stronger against a certain pathogen. C. When a drug is used too frequently. D. When a drug is expired. The correct answer is A. Drug resistance occurs when a pathogen evolves to become less susceptible to a specific drug, resulting in that drug losing its effectiveness. Which of the following is not a contributing factor to drug resistance? A. Overprescription of antibiotics. B. Incomplete use of prescribed drugs. C. Use of combination therapy. D. Proper disposal of medication. The correct answer is D. Proper disposal of medication helps prevent environmental contamination, but it does not contribute to drug resistance. How can bacteria develop resistance to antibiotics? A. By mutation and natural selection. B. By increasing patient compliance. C. By reducing the dose of antibiotics. D. By using broad-spectrum antibiotics only. The correct answer is A. Bacteria can develop resistance through mutation and natural selection. The bacteria best able to survive antibiotic treatment will multiply and pass on their resistance genes. Which term describes what happens when a drug that used to work against a germ stops working? A. Antibiotic potency. B. Drug resistance. C. Therapeutic failure. D. Pharmacological tolerance. The correct answer is C. Therapeutic failure is when a drug no longer works effectively to treat a particular condition due to drug resistance. What is multidrug resistance, or MDR, in pharmacy? A. Resistance to multiple classes of drugs. B. Resistance to a single drug. C. Developing resistance after only one dose. D. Resistance only in pediatric patients. The correct answer is A. Multidrug resistance refers to a pathogen's ability to resist multiple drug classes, making treatment challenging. Which of the following is a strategy to combat drug resistance in pharmacy? A. Prescribing antibiotics for viral infections. B. Encouraging patients to stop antibiotic treatment when feeling better. C. Developing new antibiotics and alternative therapies. D. Using antibiotics to treat non-infectious conditions. The correct answer is C. Developing new antibiotics and alternative therapies is a key strategy to combat drug resistance and ensure effective treatment options. How can healthcare providers help prevent the spread of drug-resistant infections? A. Prescribing antibiotics for colds and flu. B. Educating patients about proper antibiotic use. C. Skipping hand hygiene protocols. D. Using expired medications. The correct answer is B. Educating patients about proper antibiotic use can help prevent the spread of drug-resistant infections by ensuring antibiotics are used appropriately and only when necessary. Which term refers to a pathogen's ability to withstand antibiotics? A. Antibiotic tolerance. B. Drug resistance. C. Pharmacological resistance. D. Microbial resilience. The correct answer is B. Drug resistance is the ability of a pathogen to withstand the effects of an antibiotic, leading to treatment failure. What is one potential consequence of drug resistance in pharmacy? A. Increased effectiveness of antibiotics. B. Decreased treatment options for infections. C. Reduced cost of healthcare. D. Decreased need for new drug development. The correct answer is B. One consequence of drug resistance is the decreased availability of effective treatment options for infections, making it harder to combat certain pathogens. Which of the following is a common mechanism of drug resistance in bacteria? A. Reducing antibiotic exposure. B. enhancing the immune response to antibiotics. C. Increasing antibiotic influx. D. Enhancing antibiotic efflux pumps. The correct answer is D. One common mechanism of drug resistance in bacteria is enhancing antibiotic efflux pumps, which pump antibiotics out of the bacterial cell before they can take effect. What is meant by the term drug resistance in pharmacy? A. When a person becomes resistant to the side effects of a medication. B. When a pathogen no longer responds to the effects of a drug meant to kill or weaken it. C. When a drug is no longer covered by insurance plans. D. When a drug becomes more potent over time. The correct answer is B. Drug resistance in pharmacy refers to the ability of pathogens to withstand the effects of drugs meant to kill or weaken them. Which of the following is a common mechanism of drug resistance in viruses? A. Altering the drug target site. B. Developing an allergy to the drug. C. Speeding up the drug metabolism. D. Creating a new drug type. The correct answer is A. Viruses can develop drug resistance by altering the drug target site, making it ineffective at binding and inhibiting viral replication. What is the role of efflux pumps in multidrug resistance, or MDR, in pharmacy? A. They enhance the drug's effectiveness. B. They assist in drug delivery to target cells. C. They pump drugs out of the cell before they can act. D. They prevent drug-drug interactions. The correct answer is C. Efflux pumps in MDR function by pumping drugs out of the cell before they can act, reducing the drug concentration inside the cell. Which of the following factors can contribute to the development of drug resistance in fungi? A. Use of combination therapy. B. Proper medication adherence. C. Lack of fungal mutations. D. Inappropriate dosing of antifungal drugs. The correct answer is D. Inappropriate antifungal drug dosing can lead to drug resistance in fungi. This happens because insufficient drug levels fail to kill the fungi. What impact can drug resistance have on the effectiveness of chemotherapy in cancer treatment? A. Improving the success rate of chemotherapy. B. Reducing the dosage required for chemotherapy. C. Limiting treatment options and effectiveness. D. Preventing cancer recurrence. The correct answer is C. Drug resistance in cancer treatment can limit treatment options and effectiveness, making it challenging to achieve successful outcomes with chemotherapy. How do bacteria acquire resistance to antibiotics through horizontal gene transfer? A. By absorbing sunlight. B. By exchanging genetic material with other bacteria. C. By altering their cell structures. D. By increasing their metabolic activity. The correct answer is B. Bacteria can acquire resistance to antibiotics through horizontal gene transfer, by exchanging genetic material with other bacteria carrying resistance genes. Which of the following is a key component of antimicrobial stewardship programs to combat drug resistance in pharmacy? A. Promoting unnecessary antibiotic use. B. Educating healthcare providers and patients on appropriate antibiotic use. C. Stockpiling antibiotics for future use. D. Ignoring antibiotic susceptibility test results. The correct answer is B. Promoting unnecessary antibiotic use can contribute to drug resistance. Educating healthcare providers and patients on appropriate antibiotic use is a key component of antimicrobial stewardship programs to combat drug resistance. What is the role of beta-lactamase enzymes in bacterial resistance to beta-lactam antibiotics? A. Enhancing the effectiveness of beta-lactam antibiotics. B. Breaking down beta-lactam antibiotics, rendering them ineffective. C. Assisting in the uptake of antibiotics into bacterial cells. D. preventing bacterial replication. The correct answer is B. Beta-lactamase enzymes break down beta-lactam antibiotics, like penicillins and cephalosporins, rendering them ineffective and contributing to bacterial resistance. In the context of drug resistance, what is meant by cross-resistance? A. Resistance to a drug based on the patient's age. B. Resistance to one drug that confers resistance to other drugs in the same class. C. Resistance to drugs administered through different routes. D. Resistance that only occurs in crossbred bacteria. The correct answer is B. Cross-resistance refers to resistance to one drug that confers resistance to other drugs in the same class, often due to shared mechanisms of action or resistance pathways. Which of the following is a common strategy to reduce drug resistance in pharmacy? A. Using the same antibiotic for all infections. B. Stopping antibiotic treatment as soon as symptoms improve. C. Optimizing infection prevention and control practices. D. Prescribing broad-spectrum antibiotics for all infections. The correct answer is C. Optimizing infection prevention and control practices, such as hand hygiene and proper sanitation, is a common strategy to reduce the emergence and spread of drug resistance in pharmacy. What is the primary cause of multidrug resistance, or MDR, in pharmacy? A. Patient non-compliance. B. Use of subtherapeutic doses. C. Overuse of antibiotics. D. Proper medication adherence. The correct answer is C. Overuse of antibiotics can lead to the development of multidrug resistance, or MDR, in bacteria by exerting selective pressure on pathogens. What is the mechanism of action of efflux pumps in multidrug resistance, or MDR, in pharmacy? A. They decrease the permeability of the bacterial cell membrane to antibiotics. B. They actively pump out antibiotics from the bacterial cell. C. They inhibit the binding of antibiotics to their target sites. D. They interfere with the synthesis of bacterial cell walls. The correct answer is B. Efflux pumps in bacteria actively pump out antibiotics from the bacterial cell, reducing the concentration of antibiotics inside the cell and contributing to multidrug resistance. Which of the following is not a common mechanism of drug resistance in fungi? A. Altered target site. B. Development of beta-lactamase enzymes. C. Efflux pumps. D. Decreased drug uptake. The correct answer is B. Development of beta-lactamase enzymes is not a common mechanism of drug resistance in fungi. This mechanism is more commonly associated with bacterial resistance to beta-lactam antibiotics. What is the impact of drug resistance on how well chemotherapy works for cancer treatment in pharmacy? A. Increased efficacy of chemotherapy drugs. B. Improved patient outcomes. C. Need for higher doses of chemotherapy drugs. D. Decreased response to chemotherapy drugs. The correct answer is D. Drug resistance can lead to decreased response to chemotherapy drugs, requiring higher doses or alternative treatments to achieve the desired outcomes in cancer patients. How do bacteria become resistant to antibiotics through horizontal gene transfer in a pharmacy setting? A. By mutating their own DNA. B. By sharing resistance genes with other bacteria. C. By altering their target sites for antibiotics. D. By reducing their metabolic activity. The correct answer is B. Bacteria can acquire antibiotic resistance through horizontal gene transfer. They share resistance genes with other bacteria. This allows for the rapid spread of resistance within bacterial populations. Which of the following is a key component of antimicrobial stewardship programs to combat drug resistance in pharmacy? A. Promoting overprescribing of antibiotics. B. Encouraging self-medication with antibiotics. C. Improving antibiotic prescribing practices. D. Using broad-spectrum antibiotics as first-line therapy. The correct answer is C. Improving antibiotic prescribing practices is a key component of antimicrobial stewardship programs aimed at combating drug resistance by promoting appropriate and judicious use of antibiotics. What is the role of beta-lactamase enzymes in bacterial resistance to beta-lactam antibiotics in pharmacy? A. They inhibit bacterial cell wall synthesis. B. They interfere with bacterial protein synthesis. C. They degrade beta-lactam antibiotics. D. They prevent antibiotic binding to target sites. The correct answer is C. Beta-lactamase enzymes degrade beta-lactam antibiotics. They do this by breaking down the beta-lactam ring structure. This renders the antibiotics ineffective against bacteria that produce these enzymes. In the context of drug resistance, what is meant by cross-resistance in pharmacy? A. Resistance of a pathogen to multiple classes of antibiotics. B. Resistance of a pathogen to antibiotics and antiviral drugs. C. Resistance of a pathogen to one specific antibiotic. D. Resistance of a pathogen to bacterial and fungal infections. The correct answer is A. Cross-resistance refers to the phenomenon where a pathogen develops resistance to multiple classes of antibiotics due to shared resistance mechanisms or genetic determinants. What impact can drug resistance have on public health in pharmacy? A. Decreased healthcare costs. B. Improved treatment outcomes. C. Increased treatment failures. D. Reduced burden of infectious diseases. The correct answer is C. Drug resistance can lead to increased treatment failures, prolonged illnesses, and higher healthcare costs, posing a significant threat to public health by limiting treatment options for infectious diseases. Which of the following is a common strategy to reduce drug resistance in pharmacy? A. Using combination therapy with multiple antibiotics. B. Overprescribing broad-spectrum antibiotics. C. Ignoring antibiotic susceptibility test results. D. Encouraging antibiotic self-medication. The correct answer is A. Using combination therapy with multiple antibiotics is a common strategy to reduce the emergence of drug resistance by targeting pathogens through different mechanisms of action, reducing the likelihood of resistance development. What is the primary cause of multidrug resistance, or MDR, in pharmacy? A. Decreased drug doses. B. Overuse of antibiotics. C. Incomplete treatment regimens. D. Low pathogen virulence. The correct answer is B. Overuse of antibiotics can lead to the development of multidrug resistance, or MDR, as bacteria adapt to survive repeated exposures to various medications. What is the impact of drug resistance on public health in pharmacy? A. Increased treatment costs. B. Faster recovery rates. C. Enhanced drug effectiveness. D. Decreased incidence of infections. The correct answer is A. Drug resistance can lead to increased treatment costs, because patients may need more expensive or alternative medications to fight resistant infections. How do bacteria become resistant to antibiotics through horizontal gene transfer in a pharmacy setting? A. By mutating their own genetic code. B. By exchanging genetic material with other bacteria. C. By altering their physical structure. D. By reducing their growth rate. The correct answer is B. Bacteria can acquire resistance to antibiotics through horizontal gene transfer. This involves transferring resistance genes from one bacterium to another within the same generation. Which of the following factors can contribute to the development of drug resistance in fungi? A. Low humidity levels. B. Overuse of antifungal medications. C. High pathogen susceptibility. D. Limited fungal growth medium. The correct answer is B. Overuse of antifungal medications can contribute to drug resistance in fungi, making them harder to treat. What is the mechanism of action of efflux pumps in multidrug resistance, or MDR, in pharmacy? A. They reduce pathogen virulence. B. They increase drug doses. C. They expel antibiotics from the bacterial cell. D. They target specific pathogens. The correct answer is C. Efflux pumps in multidrug resistance, or MDR, work by expelling antibiotics from the bacterial cell, reducing the drug concentration inside the pathogen. Which of the following is not a common mechanism of drug resistance in fungi? A. Altered drug targets. B. Reduced drug uptake. C. Enhanced drug sensitivity. D. Drug efflux mechanisms. The correct answer is C. Enhanced drug sensitivity is not a common mechanism of drug resistance in fungi. Resistance typically involves altered drug targets, reduced drug uptake, and drug efflux mechanisms. In the context of drug resistance, what is meant by cross-resistance in pharmacy? A. Resistance to multiple drug classes. B. Resistance to only one specific drug. C. Complete susceptibility to all antibiotics. D. Lack of resistance development. The correct answer is A. Cross-resistance refers to the phenomenon where resistance to one drug confers resistance to other drugs within the same class or different drug classes. What is the role of beta-lactamase enzymes in bacterial resistance to beta-lactam antibiotics in pharmacy? A. Increase drug effectiveness. B. Inactivate beta-lactam antibiotics. C. Enhance pathogen virulence. D. Improve patient tolerance. The correct answer is B. Beta-lactamase enzymes inactivate beta-lactam antibiotics by breaking down the beta-lactam ring structure, rendering the antibiotic ineffective against bacteria. What impact can drug resistance have on how well chemotherapy works to treat cancer? A. Enhanced treatment outcomes. B. Reduced side effects. C. Decreased drug efficacy. D. Improved patient compliance. The correct answer is C. Drug resistance can lead to decreased effectiveness of chemotherapy in cancer treatment, as cancer cells may develop mechanisms to resist the cytotoxic effects of anti-cancer drugs. Which of the following is a common strategy to reduce the emergence of drug resistance in pharmacy? A. Underprescribing antibiotics. B. Encouraging self-medication. C. Completing the full course of antibiotics. D. Mixing different antibiotics. The correct answer is C. Completing the full course of antibiotics is prescribed as a common strategy to reduce the emergence of drug resistance. This is done by ensuring the eradication of the pathogen and preventing the development of resistance. What is the primary cause of multidrug resistance, or MDR, in pharmacy? A. Overprescription of antibiotics. B. Incomplete courses of antibiotic treatment. C. Horizontal gene transfer. D. Inappropriate use of antibiotics. The correct answer is B. Incomplete antibiotic treatment can lead to multidrug resistance. This is because the bacteria aren't fully eradicated, allowing resistant strains to survive and multiply. How do bacteria become resistant to antibiotics through horizontal gene transfer in a pharmacy setting? A. Through efflux pumps. B. By mutating their own DNA. C. By sharing resistant genes with other bacteria. D. By forming biofilms. The correct answer is C. Horizontal gene transfer lets bacteria share antibiotic resistance genes. This spreads resistance through populations. What is the mechanism of action of efflux pumps in multidrug resistance, or MDR, in pharmacy? A. They prevent antibiotics from binding to their target sites. B. They reduce the permeability of the bacterial cell membrane. C. They actively pump antibiotics out of the bacterial cell. D. They inhibit the synthesis of bacterial proteins. The correct answer is C. Efflux pumps in multidrug resistance, or MDR, actively pump antibiotics out of the bacterial cell. This reduces the intracellular concentration of the antibiotic, decreasing its effectiveness. What impact can drug resistance have on public health in pharmacy? A. Increased healthcare costs. B. Reduced effectiveness of treatments. C. Increased mortality rates. D. All of the above. The correct answer is D. Drug resistance significantly impacts public health. This includes increased healthcare costs, reduced treatment effectiveness, and higher mortality rates due to harder to treat infections. Which of the following is a common strategy to reduce the emergence of drug resistance in pharmacy? A. Promoting the appropriate use of antibiotics. B. Increasing the dosage of antibiotics. C. Prescribing broad-spectrum antibiotics. D. Encouraging self-medication with antibiotics. The correct answer is A. One common strategy to reduce the emergence of drug resistance is promoting the appropriate use of antibiotics. This includes prescribing them only when necessary, at the correct dosage, and for the appropriate duration. What is the role of beta-lactamase enzymes in bacterial resistance to beta-lactam antibiotics in pharmacy? A. They inhibit the synthesis of bacterial proteins. B. They prevent antibiotics from binding to their target sites. C. They degrade beta-lactam antibiotics. D. They reduce the permeability of the bacterial cell membrane. The correct answer is C. Beta-lactamase enzymes play a role in bacterial resistance to beta-lactam antibiotics. They do this by degrading the antibiotics, rendering them ineffective in targeting bacterial cell walls. In the context of drug resistance, what is meant by cross-resistance in pharmacy? A. Resistance to multiple classes of antibiotics. B. Resistance to a single antibiotic. C. Resistance to antiviral medications. D. Resistance to antifungal medications. The correct answer is A. Cross-resistance refers to a pathogen becoming resistant to many types of antibiotics, making treatment difficult. What is one potential consequence of drug resistance in pharmacy? A. Increased effectiveness of treatments. B. Reduced spread of infections. C. Longer hospital stays. D. Decreased healthcare costs. The correct answer is C. One potential consequence of drug resistance is longer hospital stays for patients. Due to the difficulty in treating infections caused by resistant pathogens, this leads to increased healthcare costs and impacts on patient outcomes. What is multidrug resistance, or MDR, in pharmacy? A. The resistance of a pathogen to multiple classes of drugs. B. The use of multiple drugs to treat a single infection. C. The development of resistance within individual patients. D. The combination of antibiotics and antifungals. The correct answer is A. Multidrug resistance, or MDR, refers to a pathogen's ability to resist multiple classes of drugs. This makes it challenging to treat infections caused by these resistant strains. What is the term used to describe the ability of pathogens to withstand the effects of antibiotics? A. Drug susceptibility. B. Drug resistance. C. Antimicrobial sensitivity. D. Antibiotic tolerance. The correct answer is B. Drug resistance refers to the ability of pathogens to withstand the effects of antibiotics. How can healthcare providers help prevent the spread of drug-resistant infections? A. Overprescribing antibiotics. B. Avoiding hand hygiene practices. C. Correctly prescribing antibiotics. D. Skipping infection control protocols. The correct answer is C. Healthcare providers can help prevent the spread of drug-resistant infections by correctly prescribing antibiotics, only when necessary. Which of the following factors can contribute to the development of drug resistance in fungi? A. Efflux pumps. B. Horizontal gene transfer. C. Beta-lactamase production. D. Antimicrobial stewardship programs. The correct answer is A. Efflux pumps can contribute to the development of drug resistance in fungi by removing drugs from the cell before they can act effectively.